June is Men's Health Month, a time to focus on the health issues that impact millions of men all across the country.
That's right. From life-saving screenings, the debate over PSA testing for prostate cancer, and the importance of overall health.
Joining us to tell us more is Dr. David Crowley, Medical Director of Hartford Healthcare's Tallwood for Eastern Connecticut, Men's Health, and Chief of Urology at Backus Hospital. Thank you for your time. Good morning.
Good morning.
Good morning. Thank you for having me.
Of course. Let's start with this question. Pretty general here, but for Men's Health Month, what are the most important health screenings you believe men should be getting, and at different ages?
Well, the different ages is the key. It's a moving target. So in men's 20s and 30s, we focus on, routine blood pressure checks, primary care visits, and testicular self-awareness to rule out testicular cancer. And then as men get older, into their 40s and 50s, we are looking at cancer screening for prostate and colon cancer, cardiovascular risk factors. So at Tallwood Men's Health, we use a checklist provided by the American Society for Men's Health that identifies which screenings are needed for men based on their age and individual risk. And we try and connect them with primary care providers and specialists to get that screening.
Okay, doctor, and we mentioned this in the intro, but we're talking about PSA screenings here. Can you tell us exactly what that is and who should consider getting that type of screening?
A great question, and it has been somewhat controversial in the past, but PSA is a blood test that can detect prostate cancer early when it's most treatable. And we use that in combination with assessment of risk factors and physical exam to find men who may be at risk for prostate cancer. For average risk men, we typically start screening around age 50 and continue it till around age 70. But that advice could change based on risk factors like Black ancestry or strong family history. And in those men, we're starting that conversation even at a younger age. So I think it's important to know that the screening is not one size fits all. It's a conversation with the primary care doctor or urologist, look at the risk factors and determine who may benefit the most from screening.
And this may be a topic that is uncomfortable for some people, some men, but it's obviously a conversation that should be had with your doctor. But we're talking sexual health here. It can sometimes be more than just a normal part of aging. So when do you think someone should talk with a provider? When is there something that we should be looking at, or men should be looking at, thinking it's a larger health issue?
I think it's a great point. It can be an uncomfortable topic, but it's also a real opportunity. So I see a lot of men with ED in my practice, and it's often the first sign that there may be something wrong with their cardiovascular system in general. So the vessels involved with ED are very small, and they may show damage earlier than things like the blood vessels in the heart.
Wow.
So it can be a sign there may be heart disease. And so we work really closely with cardiologists to identify these men who are presenting with ED early and see whether they might benefit from additional testing for heart disease. It's also an area we're really researching actively to see what other risk factors may be related, and a pretty hot topic in urology.
All right, great advice, Dr. Crowley. Thanks for raising awareness about this. We thank you for your time today.